Mr. President, and thank you for outlining how well we are doing in a series of metro areas. What also has been encouraging for those of you who are watching epidemic curves every day, and I'm sure you are, and watching them in log phase, because that's how epidemiologists like to look at their curves, you can see for the first time that in the United States we're starting to level on the logarithmic phase like Italy did about a week ago. And so this gives us great heart that not only in specific places, but we're starting to see that change. Obviously, a lot of that is driven by the improvement in New York City. Remember, for a long time, they were over 50% of our cases and 50% of our new cases. That has dramatically changed because of the impact of what the citizens of New York and New Jersey and across Connecticut and now Rhode Island are doing to really change the course of this pandemic and really change the trajectory of new cases. We're seeing that what many states and metro areas were experienced as twofold and fourfold increases that went to twofold, that now those are going to 8 days between the doubling rate. Watching this every day gives us hope across these metro areas from New York and New Jersey and all through Denver and, of course, through New Orleans. We still see cases occurring in the Boston area and in Chicago, but their rate of increase seems to be stabilizing. And we really want to call out the work of the mayors of Baltimore and the district and Philadelphia, who have really brought all of their health experts together and working with their communities are starting to really change the curves in those areas. What we're seeing is we're united in social distancing. And that's been very encouraging to all of us. And it should be encouraging to the healthcare providers that are on the front line, many of which are serving our Americans with such dignity and respect and ensuring that everybody gets optimal care. And as the President noted, our mortality in the United States is significantly less than many of the other countries when you correct them for our population. And that is really solely the work of our frontline healthcare providers. And so working with, you can really, hopefully you get the theme today that we are incredibly proud of our public health leaders at the city level, at the state level, at the federal level, who are working together to really change the course of this pandemic, working with their citizens and their communities to make these changes. And the American public, who have really taken all of this to heart and stayed home. I know last week we really asked a lot of people in the Washington and Baltimore area to consolidate, not go out frequently to grocery stores or pharmacies. You can really see that that's having a huge impact. So it's really about the encouraging signs that we see, but as encouraging as they are, we have not reached the peak. And so every day we need to continue to do what we did yesterday and the week before and the week before that, because that's what in the end is going to take us up across the peak and down the other side. We continue to really applaud the work of California and Washington State and Oregon. We're learning from all three of those states, from their public health officials, about how they were able to keep the virus from ever becoming logarithmic. And I think that's an important lesson for all of us on how they did that, what the timing was in case we ever have to face this issue in the future. Thank you, Mr. President.
Thank you very much, Deborah.